This is a staged conversation of a similar discussion I have with my patients and their families of what I like to call frame school, where we talk about the tailored spatial frame and its components and ultimately how to make adjustments and read a prescription. As always, if you have any specific questions about your particular external fixator or your case, discuss that with your own physician. This is a tailored spatial frame. It's comprised of a ring on top, a ring down below, and 6 struts in between. The struts we'll talk about individually in a moment or two. I just want to show you how each strut is individually numbered. 1, 2, 3, 4, 5, 6. And they're always numbered in the same fashion, moving in this direction counterclockwise when looking from the top. The struts are also color-coded: red, orange, yellow, green, blue, violet, the colors of the rainbow, and we'll talk about how those match your frame program later in this conversation. There are 2 types of struts that can be on your external fixator. Both work in the same way as far as making adjustments, but their anatomy is a little bit different, and I'll explain that to you so you have a better understanding. This strut is called a fast FX strut. This is called a standard strut, and we'll start with the standard strut. The strut has a ruler with white numbers indicating the excursion, and it has an indicator disc with a line that will tell us the length of the strut currently. The strut has a knob at the top with an arrow and a plus sign, and when this knob is turned in the plus direction, we can see by the level of the indicator mark, turning in the plus direction will increase the excursion and increase the length of the strut. Each complete revolution of the knob corresponds to 1 millimeter of distraction, or lengthening in this case. Similarly, if it is turned away from the plus in a negative direction, you can see that the strut is going in a minus direction, and the strut is actually getting shorter or compressing. The difference between the fast FX strut and the standard strut is that the fast FX strut can be suddenly lengthened or shortened. However, this should never happen while it's on you, and the fast FX strut should always remain in a locked position with this collar positively engaged to prevent sudden movements. As a safety precaution, a jam nut can be lowered close to the fast FX feature such that if it became disengaged, the strut would not suddenly change position. This is a spatial frame prescription. We'll spend some time looking at it and then talking about how you make the adjustments. The spatial frame prescription up top will have contact information, typically a phone number to the office and or email of your surgeon or assistant, and there may even be some individual case notes that your surgeon may place for you. Looking at this table, we see 8 columns. One is the date, then we have the day of the prescription, and then we have 1 column for each of the 6 struts that are color-coded 1, 2, 3, 4, 5, 6 with red, orange, yellow, green, blue, violet. Again, it's the colors of the rainbow in order. The first row below the column headings is labeled day 0, and these are the strut settings that are on your frame currently before any adjustments are made. If you notice that each subsequent row is another day of the prescription, we can then look and see where each individual strut should be set. Looking at it on an individual day, we'll notice that the first day of the prescription going across the entire row will compare to the day before. Strut 1 stays on 155, strut 2 stays on 170, strut 3 will move down 2 turns from 165 to 163, strut 4 will move down from 160 to 159, strut 5 will move from 160 to 158, and strut 6 will move from 155 up to 156. For instance, on strut 5, on day 0, it should be set on 160. However, on day 1, it should go down to 158. We look at our indicator disc, we look at our ruler, we see they match at 160. We will now turn against the positive, down 2 complete turns, which is 2 complete millimeters. We now look at our indicator disc, and we see that it's on 158, and we are now complete with the adjustments for strut 5 for this particular day. As well, when we look on the page, you may notice there are color-coded boxes. In this case, strut number 3 and strut number 5 have several days that are color-coded to match the color of the strut. yellow and blue respectively. If you look at the bottom of the page, this lets the surgeon know that during this particular range of dates that's highlighted in each color, the struts are getting near the end of their maximum excursion and will need to be changed. Typically, your follow-up will occur during these ranges so that struts can continuously be adjusted without any pause. So in summary, each row indicates 1 day of the prescription. You will follow these sequentially. Some struts may go up, some may go down, some may have no change at all. You'll make these changes every day until the prescription is complete.